biggest problems facing healthcare today is the flow and preservation of patient information. If a patient presents themselves to an emergency room in the middle of the night, frequently that patient comes without any additional information. The intaking physician frequently is at a loss to explain what the patient's past medical history is, any pertinent physical data, any previous imaging studies. And frequently these studies have to be duplicated and can impact both patient care and the cost of health care. Patients are transportable, but unfortunately their data frequently is not. There has been fragmentation, balkanization of patient healthcare data. It's easier to find out a patient's credit status than it is their healthcare status, what immunizations they've had, what prior blood work, what prior imaging studies, surgical history. A patient can give you that information by word of mouth, but you'd be surprised how often that information is inexact and inaccurate. And as a radiologist, when I am looking at an examination on a patient, I want to get as much data as I can about that patient. I will frequently talk to the patient, but if the patient is unavailable, unconscious, there's a language issue, I'm going to have a very hard time, or it will certainly complicate my job in creating an accurate diagnosis. It would be very helpful if I had access to not only the patient's previous imaging exams, but any laboratory values, any history and physical information, progress notes. Any of that data becomes important. In the current system that we have, Hospital A and Hospital B don't really talk to each other electronically. There is no, well, there are common standards, but they're not utilized effectively, and most of this data is considered to be proprietary. It belongs to the healthcare organization and not to the patient. And the patient should be able to direct the flow of that information just by giving access or granting access to the individual physicians or healthcare organizations, hospitals and clinics. What I really like about the XSTOR approach is that XSTOR is vendor neutral. XSTOR will accept data from any source, and utilizing DICOM and HL7 standards can present the previous exams, previous healthcare information in a readable format, utilizing a viewer that can incorporate all of the data and allow me to do a better job.